Chris is on the phone, also maybe hearing me in the room right now. Chris, if you can hear me.
We can.
We would like the sound to additionally be in the boardroom as well as through the stream. So a full mix is being requested right now. I'm still actively testing the Zoom integration for today's fentanyl hearing. It is Thursday, March 3rd. Tony is confirming that he can hear me on Zoom. Correct. And we know that we are live on the webcast right now.
I'm sorry. I'm just like.
So we are all muted now except for me. So we are all confirmed. I'm going to mute. Those of you who are on Zoom, just a reminder to unmute when the show begins. Thank you very much and have a great day.
Go back out that door. Make a right. You guys are sitting right out here. See this gentleman we were standing there with? Just busting your chops. everything going?
They're trying to
Okay,
kill.
thanks, yeah.
Glad you're here.
As
How
many
about
people,
you?
but for
How
as
about
much as
everything?
possible.
Yeah.
Can we
Hanging
spend
there.
$500,000 a year
Oh.
blocking?
Good morning. I think we're ready to go. We're going to begin the hearing, and I'm Katrina Foley, Orange County Supervisor. We're going to start the hearing. Chairman Chaffee is going to lead us with the Pledge of Allegiance. Please stand.
Please join me in saluting our flag. Please remember the freedoms we enjoy, and remember the blood that was shed to enjoy those freedoms and the example we have now in the world where people are dying to attain those same freedoms. Please place your hand on your heart and join me. I pledge allegiance
To the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Good morning, everyone, and thank you for joining us here today. I'm Katrina Foley, Orange County Supervisor, and I want to thank all of you for joining us. I also want to give a special thanks to our chairman, Supervisor Doug Chaffee, who is passionate about this issue and about protecting the lives of our families and children here in Orange County. Orange County, our state, and our country continue to suffer from the opioid crisis. It began nearly 3 decades ago, starting with the overprescribing of prescription opioids. That led to a generation of victims who became addicted to more illicit substances like heroin and other dependencies. Our goal today is to examine the dangers of the current opioid crisis, and specifically fentanyl on the street, in homes across Orange County, both rich and poor, and exposing our healthcare and our public safety professionals to serious health consequences. Fentanyl is a strong pain medicine intended for patients with cancer or for extreme pain relief. It is 50 times more potent than heroin and 100 times more potent than morphine. Fentanyl is illegally used as a potent additive to heroin, cocaine, and even prescription or counterfeit prescription drugs like Xanax. Here in Orange County, we're in a crisis. Users often don't even know that fentanyl is in these drugs. The fentanyl crisis is exceptionally dangerous because of the high potency and the speed with which it reaches the brain. As our Sheriff Don Barnes campaign says, just one pill can kill. Just 2 milligrams of fentanyl can kill you, whether swallowed, inhaled, or absorbed in the skin. And to put it in context, 2 milligrams, if you look at the size of a penny and you take my little pinky fingernail here, that is about 2 milligrams of what can kill you. Even the police, our first responders, and healthcare workers are at risk from inadvertently touching or inhaling fentanyl powder and at a crime scene or when trying to help a person who is an overdose victim. We will learn more about these risks from our public safety experts here today. Those suffering from an overdose involving fentanyl may require both higher doses and multiple administrations of something called naloxone to reverse the overdose and to become stabilized. While law enforcement efforts are critical to stem the flow of fentanyl in our communities, I also think that we need to find a way to address the treatment for individuals in our community. We will learn about our county treatment and recovery response and the role of naloxone during our public health panel. Orange County, like the rest of the nation, faces this crisis. No community, no city, no supervisorial district is unaffected. It seems like every single day we hear in the news about another fatality, often our young people. Just as an example, a couple of headlines. 2 Orange Coast College students were found dead Tuesday in dormitories at the Costa Mesa campus, February 11th, 2021. 2 Huntington Beach police officers exposed to fentanyl during traffic stop, Friday, November 19th, 2021. 3 found dead at Balboa Island home to possible drug overdose, October 25th, 2021. Orange County's number of fentanyl deaths is skyrocketing each year, July 30th, 2021. If a person dies of fentanyl overdose, dealer could face murder charges, November 10th, 2021. Overdose epidemic plagues California. Fentanyl is driving uptick in deaths, December 3rd, 2021. These are just a handful of headlines related to this very important crisis. In 2020, there were 503 overdose deaths in Orange County. The status quo is unacceptable. There is no simple solution to solve this complex problem, but with collaboration across different levels of government and with our partners in law enforcement, public health, and the Capitol, as well as our community, we can address policy, public health service gaps in Orange County to improve the situation and save lives. In our third panel today, we will hear our legislators and from our district attorney's office about proposed legislative tools, challenges, and how we can support legislation that will aid in the prosecution to hold those responsible accountable for fentanyl-related deaths. I think we have a little bit, did we fix the echo? Okay. I was trying to carry on, but it seemed like it wasn't going to fix. So the goal of, is it okay to continue? Okay. The goal of today's hearing is to seek recommendations for solutions through a collaborative approach. I want to again thank Chairman Chaffee for joining us today, and I'm grateful for the expert witnesses and members of the public who are here today to share their insight on this problem and so we can find solutions. I'm going to give a roadmap now for today's hearing. First, we will hear from Orange County Sheriff Don Barnes and Costa Mesa Police Chief Ron Lawrence. They'll share data about fentanyl-related arrests and deaths, the role of law enforcement, and how they play that role in responding to fentanyl in our communities, the risks to public safety, the costs on our current approach, and recommended changes or solutions that are needed. Our second panel will include county public health experts, including Dr. Clayton Chau, Dr. Veronica Kelley, and Matt Holtzman, chairman of the Orange County Behavioral Health Advisory Board. The healthcare agency officials will share statistics, current responses from the healthcare agency, and provide recommendations or solutions needed to eliminate this crisis in our community. Mr. Holtzman will address naloxone as a tool to combat fentanyl-related overdoses and provide recommendations. Our final panel will focus on state law and public policy changes needed to aid in prosecution of those responsible for drug-related overdoses. We will hear from Assemblywoman Cotty Petrie-Norris, State Senator Pat Bates, and a representative from the District Attorney's Office, Deputy District Attorney Mina Saeed. And we will hear about their state legislation solutions that they proposed. After we hear from our three panels, members of the public will have the opportunity to provide any public testimony. And members of the public can also submit comments online at d2.ocgov.com under Orange County Fentanyl Hearing. After we conclude, I will take questions from our media partners, and we thank you all for participating here today. We look forward to your testimony and to collaborating with you to solve this important community crisis. We look forward to a very productive hearing. So at this time, I'd like to begin by introducing Sheriff Don Barnes.
May I have some opening remarks, too?
Oh, I'm sorry. My
Okay.
apologies. Go ahead. Yes.
Thank you for bringing us all together so we can get our hands around the fentanyl crisis happening in Orange County, especially in light of the COVID-19 pandemic, which, thanks to good work of county, is easing, but the fentanyl crisis is not. The pharmaceutical opioid fentanyl was created to treat advanced cancer patients or those in extreme pain. However, illegally produced fentanyl has been fueling an epidemic. This fentanyl is sold in the illicit drug market so dealers can stretch and increase the amount of their street drugs. They don't need as much heroin if you can get the same high by adding a little bit of fentanyl to it. They are cutting fentanyl into street drugs such as heroin or cocaine and then pressing them into illegal prescription pills. These drugs end up on the streets and often in the hands of unsuspecting residents. With the advancement in technology and social media, it's never been easier to access illegal drugs and increasingly drugs laced with fentanyl. The COVID-19 pandemic, the resulting lockdowns, and social distancing contributed to an increase in illegal drug use. As we continue to see a rise in the number of fentanyl-related deaths in Orange County over the years. After the second panel provides their testimony, I have to leave to another engagement. If I can be back for the press conference, I will. I'd simply like to say that we are the OC. We do things right. We will certainly lick this thing with the great resources we have and the terrific people, most of whom you'll hear from today, leading the charge. Supervisor Foley, go ahead.
Thank you, Mr. Chairman. Now, at this time, I'd like to introduce Orange County Sheriff Don Barnes. Sheriff Don Barnes has served as Sheriff Coroner of Orange County since 2018. He presides over the department of roughly 4,000 employees and is committed to keeping Orange County residents safe. Sheriff Barnes has been a leader in our community addressing the fentanyl crisis. We are grateful he is here today to share his insights. Sheriff Barnes?
Thank you, Chairman Chaffee and Supervisor Foley, first for the opportunity to bring to light the issues we're facing with the fentanyl crisis. I also want to thank my partners sitting here with me. We are united in Orange County about our efforts to take on the fentanyl crisis, and I think collectively we can solve this problem, but it will take some very deliberate and intentional efforts to do so. But we do have the right people, as Chair Chaffee had mentioned, to solve these issues. The drug epidemic created by fentanyl is our nation's most significant long-term public health crisis. If not for COVID-19, it would be the issue we are facing of the day, and we will continue to deal with those issues. And it is creating a public safety crisis for our first responders, and that includes our healthcare system. For the first time in a 12-month period, nationwide drug-related deaths exceeded 100,000 people. Between April 2020 and April 2021, a total of 100,306 Americans lost their life to a drug-related death. To put that number in perspective, a few years ago in 2018 and again in 2019, a Boeing 737 crashed in each year. This is the equivalent, what we're dealing with today with our fentanyl crisis and the lives lost. If you could picture 10 Boeing 737s crashing each week consistently for a year is the equivalent of the lives lost during that period. And we are responsible to take appropriate action and intervene where necessary and when those who are experiencing challenges are willing to accept help. Today I want to talk about the problem and what contributes to it, what we're doing as a Sheriff's Department, and I think I speak for my peers in law enforcement in Orange County, and what needs to be done to make our efforts a success. First, let's define the problem. The biggest component of the 100,000 deaths are synthetic opioids, specifically fentanyl. To put that in perspective, just over the last several years and a decade, in 2013 nationally, fentanyl was responsible for 4% of the deaths people experienced that were drug-related. In 2018, it increased 10 times to 40%. CDC is now reporting the most recent data that fentanyl or synthetic opioids are responsible for more than 70% of the deaths nationwide, and it will continue to increase exponentially. As you mentioned, Supervisor Foley, 2 milligrams of fentanyl can be lethal. To put that in perspective, a sugar packet is exactly 1 gram. You dump that sugar packet onto a table, that's 500 potential lethal doses of fentanyl and what that would look like. In Orange County, our fentanyl-related deaths have increased nearly 1,100% from 37 in 2016 to 432 in 2020 and are expected to almost double again in 2021. This number continued to grow with 636 known fentanyl-related deaths or confirmed fentanyl-related deaths in 2021, with 150 cases still pending toxicology, and more than likely a good majority of those will be the result of synthetic opioids, specifically fentanyl. According to the California Department of Health, statewide fentanyl deaths increased nearly 1,600% from 239 in 2016 to 3,946 in 2020. Included in these numbers, unfortunately, is Alexander Neville of Aliso Viejo. Alex was 14 years old when he took a single pill he bought off Snapchat, which we refer to as Drug Hub. It is a counterfeit OxyContin pill unknown to Alex, and it contained fentanyl. And I want to be clear on what this means when I say counterfeit. The cartels are clandestine producing counterfeit pharmaceuticals. And some people might think that it has the pharmaceutical qualities that are laced with fentanyl. There are no pharmaceutical qualities in that pill. It only contains fentanyl, but made to look like Xanax, OxyContin, oxycodone, and other pharmaceuticals, and sold on the black market, the dark web, or through social media platforms. Unfortunately, Alex, like many others, teens or young adults, was found deceased in his bedroom the morning after by his mother. In fact, 3 out of 4 young teens and adults are found by their parents deceased, oftentimes after they are too far and can't be revived. Unfortunately, the story continues to be experienced by other parents. According to our coroner's data, fentanyl is now the leading cause of death for children under 17 and under. There were 19 juveniles who lost their lives to fentanyl-related deaths in 2021. Just this past weekend, our deputies and coroner responded to another fentanyl-related death of a 15-year-old in South Orange County. Many people have asked me why cartels would sell a product that kills so many customers. Sadly, it's the cold-hearted reality is that it's the business of the drug trade. The bottom line is all that matters, and profits are put above the lives of people. Drug kingpins, cartels, drug trafficking organizations have done the math and determined that creating new addicts is more important, and those who lose their lives are just a lost leader to them and the business of narconomics that exists. Fentanyl is cheaper to produce, easier to traffic, it's not dependent on climate to grow the opium poppy, and it is much more lethal, and the profit margins are much greater. It can be masked in the form of counterfeit pills, as we discussed. It's also being mixed or placed in others, including marijuana now. We have marijuana-laced fentanyl that's being produced as well to create different addictions. At the Orange County Sheriff's Department, we're fighting the battle against the cartels and working to save lives. This is being done by seizing drugs, educating the public, and holding drug traffickers accountable. And I would also say getting people into sobriety within our jails, and I'll cover that in a little bit. Our Sheriff's Department has multiple narcotics teams. In fact, we have 6 different strategies and teams that work 24/7, 365 to address the flow of drugs into our county. Our fentanyl seizures continue to grow each year. From 2016 to 2020, we seized, just the Sheriff's Department, 388 pounds, which equates to approximately 88 million potential lethal doses of fentanyl. In 2021, our Sheriff's Department investigators seized 104 pounds of fentanyl, which equates to 22 million lethal doses, and 16,278 clandestine produced pills. Sadly, in the first 2 months of 2022, we have already seized 205 pounds of suspected fentanyl and 143,000 clandestine produced pills containing fentanyl as well. You can see on the slide what this looks like. And put that in perspective, one of those kilos of fentanyl is equivalent to 50 kilos of heroin, street-level heroin, that would be brought over the border. The amount includes a recent case in which we worked with our federal partners at the DEA And the local postal inspector, this case resulted in 138 pounds of fentanyl, 42 pounds of methamphetamine, 15 pounds of marijuana, 2 rifles, 2 handguns, and an arrest of an individual. While we continue these efforts, I must point out that our resources are outmatched due to the sheer quantity of what is being trafficked. We need 3 things from our partners and from the federal government to help stop the flow of narcotics into not only Orange County, the state, and the nation. And by the way, when I say the nation, the 5 corridor is one of 2 main trafficking corridors into the nation for narcotics. So things making it, drugs making its way north into Orange County, goes north and east from here, feeding the rest of the nation's addiction. The federal government must fulfill their responsibility first and foremost to secure the border. The lack of enforcement at our border is a gift to the drug cartels, and they are taking full advantage of it. The federal government's failure at our border is endangering so many communities, and fixing this issue, this single issue, would be the greatest barrier to curbing narcotics trafficking into our nation. We need to also increase the funding for the high-intensity drug trafficking area initiatives, known as the HIDAs. These are initiatives out of ONDCP, Office of National Drug Control Policy, and provides funding and collaboration with our federal partners to disrupt drug trafficking enterprises. The funding is specifically targeted to those areas of the county most impacted by drug trafficking. Orange County is included in the Los Angeles area HIDA. We have one of 5 initiatives that are driven out of that Los Angeles area HIDA, known as the Regional Narcotics Suppression Program, been in existence for over 3 decades. Funding for HIDA has remained relatively flat over the past 5 years, and I've asked our federal partners to consider increasing that number significantly so we can bring the necessary resources to continue to build out the program and fight the war that's coming across our border in narcotics. These funds are utilized to support our program, multi-agency law enforcement. Many of the chiefs you see with me and the representatives participate in the multi-agency collaboration, including federal partners, on our HIDA program. Over the past 5 years, we have seen a decline of nearly 20% in personnel assigned to RNSP for a variety of reasons. Sometimes that is funding, it may be staffing issues. We are all faced with trying to attract people and retain them into law enforcement. That's manifested into a reduction of personnel at our HIDA program. We went from 43 staff in 2017 to 35 staff members in 2021. While my department has kept a total of 25 personnel assigned to the RNSP program, a lack of financial resources have forced federal agents to reduce their number of personnel by 50%. Similarly, municipal departments have cut their contribution by 45%. The staff reduction has resulted in the elimination of 1 full team of investigators, leaving only 3 teams available for the extensive workload. And believe me when I say workload, there's more than enough work today to add not only 1 more team back, but probably additional teams if we had the resources to do so. Significantly increasing funding for the HIDA will bolster law enforcement's efforts and provide tools needed to stop and disrupt the cartel's trafficking narcotics into our country. And lastly, and this has more to do with federal policy, permanently schedule fentanyl analogs as Schedule I drugs. Currently, analogs are only temporarily on the schedule, and I will tell you the greatest risk and discussion happening at the national level is returning fentanyl as a Schedule I drug, but only if there's not mandatory minimum sentences. And that might sound political, but what we've realized in California through legislative inaction from Sacramento to include fentanyl in the same way that cocaine, methamphetamine, and heroin is enhanced penalties for trafficking has actually a perverse outcome of encouraging and incentivizing the cartels to traffic pure fentanyl, because the penalties for doing so are less than that of trafficking cocaine, heroin, and methamphetamine. Not including fentanyl trafficking mandatory minimums at a federal level will have the same outcome nationally to encourage and incentivize the cartels to traffic pure fentanyl over other narcotics. And lastly, the education and treatment. Stopping the influx of fentanyl is not just a battle fought by peace officers on the front line. We we also have to have proactive outreach and education focused on prevention. And I'm proud of our relationship we have with healthcare agency and our collaborative partners, and you'll hear more from them later about some of the opportunities that we are working towards, already implemented, and opportunities that we will implement, hopefully in the near future. This school year, we launched a new drug education program for middle school students outlined or entitled Above the Influence. This drug education curriculum is taught by deputies and to students in the classroom. The lessons are contemporary and engaging. The department remains committed to providing this education to as many schools as possible, but are limited by our manpower. More resources for this education is needed. And I want to be clear about this program. It's created by Sergeant Brian Gunsoli, who works for me in our drug education unit. He did the research, industry experts, and built a curriculum that was necessary and more contemporary. It's not a scared straight program. It is an educational program that helps young adults, young kids, make better life choices. For years, the scared straight programs didn't work. In fact, young teens and adults would oftentimes, if they experimented with drugs, would come to the conclusion that that you've been lying to me. You told me it'd kill me. It didn't. It actually made me feel better, and that manifests into addiction and later life challenges. This program is built towards life skills, making better life choices, how to deal with peer pressure, how to seek help if you need it, how to look out for your peers and offer assistance when necessary. Treatment must also as an important aspect of a comprehensive strategy to address the drug epidemic. At the Sheriff's Department, we have a naloxone program that's been in place since 2015. In fact, our crime lab in Orange County, which I run, noticed or recognized the first presence of fentanyl west of the Mississippi back in that year. And knowing and seeing the trend that would be created, implemented a naloxone program with all of our frontline personnel, including those deputies who are assigned to custody operations, because drug trafficking is an issue into the jails. We're addressing that issue as well. Our crime scene investigators who often respond to these crimes, and also our coroner investigators who respond to deaths. Well, this program, each year our deputies carry naloxone and are prepared in the event of an overdose or a fentanyl-related impact. Naloxone has been used 347 individuals in the last 5 years, and we have saved many lives with that program. Last, I'll talk about what we have implemented into our jail many years ago, which is a MAT program, Medicine-Assisted Treatment, for opioid addiction. We have successfully in bringing those suffering from addiction into sobriety and on the right path towards recovery. And to put that in perspective, under normal population circumstances pre-COVID, we would have between 550 and 725 people who are entrusted to our care in our MAT program, getting them back into sobriety. It cost us $2 million a year to manage that program, and now there are new strategies coming forth from the federal level and the state to subsidize those programs, and we intend to hopefully get that program covered by other sources and reinvest that money in other areas dealing with these issues. As you can see, and hope that you've heard from me, this remains a top priority for my office to work collaboratively with partners, both in the county, in the state, and federally, and locally with my law enforcement partners here with me to address the issues of fentanyl and drug addiction. Last, I'll talk a little bit about accountability. We know that accountability, without accountability in our law, there will be no reason for traffickers to stop an activity that's been potentially negative for so much profit. In Orange County, we work hard to safeguard the community by arresting people who break the law and hold them accountable for the tragic results of their actions. And I will say that arresting people is half of it, but treating them while we have them is the other important other half, and we are all in on that endeavor. In 2021, we began issuing advisements to those who are arrested for selling narcotics. That's much like an advisement you'd get for being arrested for DUI. If you sell a narcotic to an individual and that individual is harmed or loses their life, you may be charged with a capital offense. That action is made clear, and we are working towards the effort of holding those people accountable who have done that for the careless consequence of lives lost as a result of fentanyl trafficking. We're also conducting investigations on drug-related deaths. We're utilizing our homicide investigators to determine where the victim obtained drugs and filing cases to hold them accountable. And to put this into perspective, normally in years past, if we had what was oftentimes called an overdose, somebody who was seeking out narcotics and used too much, you've heard me use the term fentanyl-related death. A lot of the lives lost are being lost by people who are unknowingly consuming fentanyl in some other experiment, but still unknowingly consuming fentanyl, which is taking their lives. We enforce the law, but our state penalties have to be changed. They're insufficient. We had several, I'll call them social science experiments that have taken place over the last decade, Prop 47, Prop 57, and others that have reduced and decriminalized the actions of individuals and in some ways incentivized drug use. We have found, and we're finding out, that that experiment is failing. We're creating addicts at an exponential rate. And when you look at the economy that's produced, the narcotics economy, it's hard to blame foreign bad actors when we are creating a demand issue north of the border. As long as there is a demand for narcotics north of the border, there will be a supply outside of this nation that will rise up to meet it. We have to deal with our addiction issues first, while at the same time trying to curb the trafficking from south of our border. And until we do that, we are going to have a compounded problem going forward, in my opinion. And I believe we are poised in Orange County, specifically with my partners here with me, with our partners in healthcare agencies, with our partners in the community who you'll hear from a little bit later, and with resources necessary to bring in those strategies to really get people back into sobriety and stop the ill effects of fentanyl into the county. And I know Chief Lawrence will present, and I'm available to answer any questions you may have of me now or after his presentation. Thank you for the opportunity.
Thank you, Sheriff Barnes. We appreciate that very in-depth presentation. My first question was, what specific recommendations do you want the Board of Supervisors to consider to assist law enforcement? But you already answered that question, so thank you very much for that. Is there anything more specific that you would like to share with us at the county level that we can do to assist you in your efforts?
Sure, thank you for that opportunity to answer that question. I covered over it. First, I will tell you one of the greatest successes we have realized at the B-Well campus that was opened in Orange. We have taken over 400 individuals who are in crisis, behavioral health crisis, mental health, or oftentimes in drug use crisis to that facility. I know there's plans to bring another one on board and maybe one more in the future. When you look at, and I think I'm going to speak for my peers, in fact, I know that I am, the first face of somebody who's in crisis that they see in government should not be somebody wearing a uniform, a gun, and a badge. We have to have off-ramps to get people off into other treatment opportunities before they decline into criminal conduct or require a law enforcement response. And if we can get out of that business entirely, that would be phenomenal. Let us do the three prongs of policing, which are crime prevention, apprehending criminals who commit crime, and order maintenance within our community. That's what policing is for, not dealing with social issues. We partner quite well with our with healthcare, and you'll hear later from several of them for opportunities. We're going to work to map the system, and when I say that, look at what we've created over the last several years in Orange County and identify gaps or opportunities which we can fill with services and service provision. Probably the greatest barrier that I see is we have phenomenal programs in our custody operations to get people into either mental health stability or into sobriety and transition them a warm handoff, but the system post-release needs to be built. It needs to be built to be much more robust. And I know there's monies coming federally and through the state, potentially through CalAIM and other opportunities to build out that system. The greatest travesty is to get somebody into sobriety and then have them come back a month later because they failed post-release. And I'm all in for stopping that recidivism, that revolving door that keeps occurring within our county. And if we can have those stopgaps of post-custody sustainable treatment to keep them into sobriety, into mental health stability, and stop them from coming back, we all win. That's a win for all of us, including especially the people who are struggling the most, and their families who are trying their best to keep them into sobriety. So I
Thank
think
you. Yes,
that's
I
probably
think
the
we
best.
are all in for that, for sure. That's a really important component of the strategy. As it relates to recommendations for our state legislative partners, do you have a specific recommendation that you'd like to make here today as to changes that you would like to request?
That's a heavy lift. So I know that Prop 47 was voted on by the public. I don't think the public really truly knew what they're voting for based on the ballot title. It was the largest decriminalization of the two categories of crime that we all deal with in public safety, which is drug-related crime and property-related crime. It's had a perverse outcome of a lack of accountability for those who are addicts, and that's the only way I could phrase that. Prior to Prop 47, there was tremendous incentives for people to get into programs, to get into sobriety, participate in their own treatment. Those don't exist anymore, unfortunately, because of the way the criminal justice system now works. Misdemeanors are much more difficult to hold people accountable. I'm not saying that people should go to prison for drug use. I'm not saying we should incarcerate addicts. I do know that we have great programs, but there is no incentive anymore for people to participate in their own treatment. Used to be a carrot that you could dangle to get somebody into treatment, which is always the intent. We always had PC 1000, Prop 36, drug courts, all these off-ramps that existed, and getting people to participate has been very, very difficult. So I think there has to be greater accountability on the user's part. I mentioned the legislation that we proposed through Senator Bates and Assemblywoman Connie Petra-Norris for several years to change the law to curb fentanyl trafficking. If we could do more to hold the traffickers accountable, not the users, get users in treatment and stop producing new users or addicts, but to hold the traffickers accountable, I think would be paramount. And lastly, on the federal level, the funding I mentioned already, but to address some of the issues that's creating this environment where drug trafficking can occur in the black market. On the dark web, holding social media platforms accountable with some sections that they hide behind, quite honestly, to stop the allowance of the trafficking that's occurring through social media platforms, I think would be key.
Thank you. Before I move on to Chairman Chaffee, who has a couple of questions, I wanted to ask, we have Mr. DeMarco here, who's our Legislative Affairs Director here for the county. And as far as our priorities for Orange County go, I think most of what Sheriff Barnes talked about falls within our legislative priorities. Is that right?
I can answer.
Mr. DeMarco, oh, you want to
Yeah,
answer?
I can tell them you're absolutely correct. And so I'm sorry, Peter, I answered for you.
That's okay.
But I will tell you, and this is what where the opportunity becomes very interesting, is as the Sheriff of Orange County, I'm involved in several national initiatives. And I take every opportunity when I'm in D.C. to meet with our federal partners. We have representatives from Drug Enforcement Agency here today. We have a great collaborative relationship with, and to stress these issues. In my recent visit to D.C. just about a month ago, I met with Senator Feinstein. I met with Congressman Mike Levin. We had several conversations with others, including Lou Correa, about some of the issues. And when I say we're on the map, believe me, we are attracting the nation's attention at the efforts and successes we have implemented here in Orange County. Members of Senator Feinstein's team just visited the Be-Well campus and also our custody operation to see what we're implementing there. So that includes meetings with FBI, DHS, ONDCP, and others when we have the opportunity. So we are really raising the banner on these issues and getting hopefully national and statewide support, not only through funding, but also in supporting our initiatives locally, and quite honestly, I believe emulating there elsewhere. They need to emulate the programs we have implemented to the benefit of the rest of the nation.
Thank you. Okay, Chairman Chaffee, did you have any questions for Sheriff Barnes before we move to Chief Lawrence?
Yeah, we are running a little behind, so I'm going to be very brief, if I may. What's key to me is educating our kids at the opportune time. You know, they're young, they don't have experience, they feel invulnerable, they like to experiment, so I commend you on what you're doing. I know the DA has a GRIP program, and it seems like they're targeting the same age range. have you considered working with the GRIP program and expanding the knowledge that both your program and the GRIP can provide?
Yes, thank you for that question. First, we have participated in GRIP since it was implemented 15 years ago. Our agencies always partner with the DA's office on the GRIP program, as well as about 6 or 8 other agencies, some of them with me here today, who participate in GRIP. So that strategy, that early intervention, works very, very well. That program is funded through tobacco lawsuit money that was brought forth many, many years ago, I believe. And we're looking at potentially investing some dollars that might be brought to Orange County in the same way. The biggest challenge that we face, and I say we, including my partners, I don't want me to speak for them, is we're challenged. We're challenged in budgets. Where we want to invest is oftentimes prohibitive because of dollars not made available. Every dollar we spend on one program is a dollar not available somewhere else. So it takes a very intentional effort to invest in these programs. I've run juvenile programs for many years. Every dollar you spend in juvenile intervention programs saves $7 on the back end in adults. So it is really literally an investment with the cost savings that does occur. The drug use as life abuse program that I run, which is like a DARE program that many agencies would run, is a 501c3. It's funded through contributions, and deputies working there are funded, and staff is funded through this 501c3. So to answer your question, Chair Chaffee, it takes an intentional effort to invest early. I'd much rather be proactive and preventative than be reactionary and responsive later in life with adults who made poor life choices while they were young teens. I think we'd all agree that's a better investment of our time, but this takes taxpayer dollar investment to put into there. We're trying to build out the program to share. We're trying to get additional funding for 2 additional deputies so that we can add more schools in this program. And that's just the tip of the iceberg. The next year, we're going to design a middle school or junior high school program, and then we'll go back to high school. We're looking at this as a progression on these efforts. So,
Thank you for your efforts. I think that's really key. As you point out, it's a savings later on. That's going to be true of so many things in mental health and physical things with young kids. If we can get to it early, it is a savings and gives them a chance to succeed as well. So I think if Peter DeMarco were here, he could make a list. I think we could ask our legislature for some additional funding to work with youth and the programs that we need, like the ones you're doing, to prevent the fentanyl use. Thank you for coming in, Mr. DeMarco. You're very timely, so thank you. So I have no further questions. Thank you.
Thank you. And that dovetails nicely into Sheriff Barnes. I think what would be really helpful to us, both from the Board of Supervisors as well as for Mr. DeMarco, as we're advocating for additional funding from our state and federal partners, if we could get sort of a cost summary of what are the costs that are being incurred right now to manage and address the fentanyl crisis. Just isolating those costs, I think would be really helpful to us so that we can pursue funding from our state and federal partners, which is where we get most of our funding for these kinds of programs. So thank you for being here today and providing us this really thorough information. And Mr. DeMarco, we will hear from you maybe a little bit later, but thanks for coming down. And then, so now we're going to turn to our Costa Mesa Police Chief, Ron Lawrence. Chief Ronald Lawrence serves as the Costa Mesa Police Chief. His department has successfully apprehended several major fentanyl traffickers. And we look forward to hearing from his leadership and experience on the issue. And I'll say, addressing the Prop 47 issue, I know as the former mayor of Costa Mesa that we really have struggled over the last several years because of Prop 47. And so we have had to find creative ways to address what normally would be an arrestive situation. And so we're excited to hear from you today as the new police chief for Costa Mesa. I follow your work and I see you're doing a great job. And so Chief Lawrence.
Thank you very much, Chairman Chaffee and my supervisor, Katrina Foley, for inviting me to speak here today. When I was asked to partner with the sheriff, I was honored to do so, and I just want to thank our sheriff for being a real leader in this area on fentanyl, because not just locally, but he's a leader at the state level and nationally as well. And I think it's important to have these conversations so that we all realize this is a tragic issue we're facing. And so everything that the sheriff just mentioned, I wholly support. And I know that it's these coordinated partnerships that really will make sure that we get to the end result, which is to fix this problem. I'm pleased to hear that Senator Bates and Assemblymember Petrie Norris are working with our sheriff on some legislation. I think that's a good start. And Prop 47, of course, as we've already mentioned, has really been a thorn in our side. I often hear proponents of Prop 47 say to the police chiefs, and I've had an opportunity to speak to many police chiefs up and down the state of California. And the first thing they say is, well, you cops, you just want to throw people in jail. And that's just simply not true. There's not a police chief in California that wants somebody who's addicted to be in jail. What we want is for them to get clean and sober, to get the help that they so desperately need, and to be productive members of society and to live and to thrive. And Prop 47 really reduced these dangerous drugs from felonies to misdemeanor, as the sheriff mentioned, really tying our hands at getting people the help that they need. And it's frankly an inhumane way to deal with drug addiction. I wanted to start just by mentioning at the local level, we've got some police chiefs behind me here. I'm going to speak with the lens of Costa Mesa, but really I'm representing any town USA, because this permeates not just in Orange County, not just in the state of California, but nationwide. And for those in my community or any community that thinks, well, this is somebody else's problem, this is an addiction issue, it's not my family, it's not my neighborhood, they're gravely mistaken, because it permeates in every community in the United States. And Orange County is taking the leadership role in doing something about it, not just through enforcement, because it's not just a law enforcement issue, as the sheriff mentioned, but through education and making sure that we get the right legislation to hold people accountable. So I want to make sure that I understood fentanyl, because I'm not an expert at that. I am an expert at being a police chief and keeping a community safe, but I'm not an expert in fentanyl. So I really wanted to understand the why. And for many people that don't know somebody that's suffering from addiction or has been exposed to what fentanyl does, it's similar to other opioid painkillers. Fentanyl produces an effect such as relaxation, euphoria, pain relief, sedation, confusion, drowsiness, dizziness, nausea, vomiting. Unfortunately, it also results in fainting, seizures, and oftentimes death in small doses, as we've discussed. There's, of course, the pharmaceutical fentanyl, which is useful in that setting, but the illicitly manufactured fentanyl, which we believe to be mostly manufactured in Mexico and coming across our borders, is said to be 50 times more potent than heroin and 80 to 100 times stronger than morphine. Unfortunately, as has been pointed out, the cartels are lacing other drugs with fentanyl to increase their potency as well. And so we have unsuspecting people that are taking drugs not knowing that it's laced with fentanyl and who are exposed to this and unfortunately suffering death quite often. In my town, and I think it's indicative of many communities throughout California, we have about 115,000 people, so cities my size will probably have similar statistics. We experience about 4 fentanyl overdose deaths each month. Now, my town's not that big, 16 square miles, 115,000 people, 4 deaths each month is our average, and that is an absolute tragedy. And it impacts not just those individuals, but their families, their friends, and our communities that really have to manage through those emotional issues. Like the Sheriff's Department, most police departments also issue Narcan for our officers to administer. It's a nasal spray. When we experience somebody that's having a fentanyl overdose, we're able to hopefully administer that, and we've actually had several instances of saving lives. In Costa Mesa, in just this year so far, we've administered Narcan 5 times. Last year, it was 10 times. Sometimes successful, sometimes not. And if you think about the impacts, not just to the families, if that doesn't appeal to you, that people are actually dying. If it doesn't appeal to you that we've got people suffering from addiction issues that are unknowingly and unwittingly ingesting fentanyl, then let me speak to just the business impacts. And I'm happy to hear us mapping out this problem, not just in law enforcement, but as a systemic issue. If you think about a police officer responding to a call, the paramedics and the fire department responding to a call, the time it takes to investigate that crime, and I'm going to talk about that in just a minute, investigating the deaths. And then the impacts to the emergency rooms, to the hospital, to the healthcare system. These are real dollars. And so when we look at this issue, the first and foremost issue is that people are dying, and it's tragic. But there's a business side to this too. It's costing the taxpayers dollars to deal with the fentanyl issue. In Costa Mesa 2021, last year, we had 100 fentanyl-related arrests, and so far this year, we've had 48 fentanyl-related arrests, but they're not easy. It's not easy to prove, and we've shifted now. We've made this pivot with the support of our district attorney and our federal partners. If we can identify somebody who knowingly provided fentanyl or sold fentanyl, knowing that it could cause a death, then when they can be charged with murder. And so we've pivoted our investigations of these types of deaths to more of a homicide type of investigation, which is much more in depth, because now we're looking for search warrants to get into a phone, to search a home, and that all takes time and money and effort as well, all for the right reasons, because if we can identify people that are doing this and charging them with homicide, I think that will be a good thing to hold them accountable. Between 2018 and 2022, Costa Mesa seized 268 pounds of fentanyl and over 15,000 fentanyl-laced pills. I'm happy to say that our city council is wholly in support of the county. We're following your lead on passing a resolution to support law enforcement, our efforts to eliminate the threat of fentanyl in our local community, and support not only the sheriff's department, but our entire county. Working with the district attorney, I mentioned we worked closely with them on these cases, but we also work with the DEA, and they're here today. Sarah Stefik, special agent in charge with DEA, and some of her lead agents are with us, and we work with them to obtain indictments on suspects that we can prove have provided fentanyl unknowingly, so that we can charge them at a federal level for homicide as well. Like the sheriff's department, local agencies are also now issuing advisements to people that have been in possession or arrested for fentanyl that it can kill, so that we can prosecute them later if they're still a second or third time arrested for selling or providing fentanyl. We've also really launched an education campaign to make this awareness to light, which is really helpful, these types of forums, to talk about it, because most people in our communities don't see this as their issue, when in reality, it really is. So we've worked with the DEA on their One Pill Can Kill awareness campaign, and I'm happy to see that that's helping to get the word out about how this impacts our local communities. And I'll just end with this, supervisors, that the sheriff's asks are the same as local municipalities. 100% Prop 47 is a real issue. That is a bigger issue, but immediately, funding will help our HIDTA task force, and finding ways to hold people accountable for killing our community members. With that, I'll conclude my remarks and answer any questions you have.
Thank you, Chief. Chairman Chaffee, did you have any questions?
Just one, really. You've successfully apprehended several major fentanyl traffickers, and thank you for doing that. I was wondering if you and your team have learned any lessons from fentanyl-related raids and arrests, doing that, whatever stories you might want to share with us.
Yeah, I appreciate that. Of course, I don't do that work. I have a great team, my police officers, my detectives, our dispatchers. They do phenomenal work, as do all of our law enforcement agencies. And I'll say two things. One, it's not just Costa Mesa. We work closely with our partners, our neighboring cities, our sheriff's office, the DA's office. And I think that when you look at these types of investigations, from investigation to apprehension to prosecution, it's a complete collaborative effort. And the other thing I'll say is, I mentioned the pivot to these investigations. Prior to fentanyl being in our awareness, we were dealing with this much differently. It was an accidental overdose, if you will, and it was an unintended death investigation. Now this pivot is looking at it as a homicide investigation and making sure that we're doing everything we absolutely can to find out where it came from, what happened, and who did it, so that we can apprehend the right people.
Thank you for that. Appreciate that. I have no other questions.
Okay,
Thank you.
thank you, Chief. I have a question. in the 148 arrests that you've made in Costa Mesa since 2021, do you have any data that you're collecting that show whether or not these are Costa Mesa residents or people from outside of the area?
We do have that. I don't have it with me today, but we do collect that just as a matter of the totality of understanding, connecting the dots of where these drugs are coming from. And as the sheriff mentioned, a lot of these, mostly we believe they're manufactured by the cartels in Mexico coming across our border. But then as they're in our communities, it's important that we track where they came from. And part of that's understanding who we're arresting, where they live.
Okay. I think we'd be really interested in knowing because it seems to me that, at least from my experience as a city council member and mayor in Costa Mesa, much of these crimes are being committed from people that are coming into the community who are not residents of the community, and I'd just love to see if the data supports that hypothesis. And then as it relates to fentanyl on the streets and the exacerbation of homelessness, can you comment on whether or not you think that the fentanyl crisis is contributing to the individuals experiencing homelessness and a different type of homelessness issue that we're now confronting?
Well, I can say anecdotally, yes. I mean, addiction often will trail to homelessness, so there is an overlap there for sure. And when we talk to our homeless population, there's a litany of reasons why people are homeless. Sometimes it's mental health. Sometimes it's they just suffered a tragic loss and they have no avenue for housing. Sometimes it's housing expense, but oftentimes it's addiction. And by and large, a vast majority of the homeless population that we deal with are suffering from some level of addiction, whether it's fentanyl or some other drug. So there is an overlap, but of course that's anecdotal now. But there's no doubt in my mind that those two are related.
Yeah, it seems to me that as I travel through the county and through the cities and home and to work, the age of the individuals on our streets is much younger. And so it leads you to believe that it has something to do with addiction more than anything else. But that's, of course, just anecdotal as well. Although we did commission a survey, and we are going to be providing that data in an upcoming hearing here in a couple months. So one last question, and I'll pose this question to all the chiefs in the room here today, and I really want to thank you all for being here. It's really important to the work that we're doing here collaboratively that you're here. And that is, we'd like to get some quantification of the costs on and the impacts to our local governments for having to manage and fund resources, whether it's staff resources or purchasing of Narcan or whatever the resources are. I think it would be really helpful to our legislative strategy and our requests for funding at the federal and state level if we could start to collect that data from all of our law enforcement agencies here in Orange County. So I'll ask if you could maybe help us to get that data.
Absolutely.
All right. Thank you so much for being here today, both of you. We really appreciate you taking the time out of your busy schedules, and we thank you for your efforts and your good work on behalf of Orange County residents and businesses alike to protect and keep safe our community, and especially your efforts to have a collaborative approach that couples law enforcement efforts with treatment and prevention. So thank you so much for that. And we'll take a brief recess. Orange County Healthcare Agency and our county health care officer. Under his leadership, the healthcare agency has prioritized behavioral health treatment, and we're thankful for his insights that he will share today. Dr. Clayton Chau.
Thank you. Good morning, Supervisor Foley. Thank you for putting this panel together and for the opportunity to speak to you. I think in the interest of time, what I'm going to do is I'm just going to give a very brief overview of what fentanyl is and stress the importance of why it is lethal. And you, as you have indicated earlier, I was very impressed with the statistic that you gave. It is actually a synthetic opioid that is very, very strong, as you have pointed out. It's 100 times more potent than morphine and 50 times more potent than heroin. And so I'll give an overview, and I'll talk a little bit about what is the National Institute of Drug Addiction's recommendation as related to treatment and preventions. And then I will ask Dr. Ronnie Kelley, who is our Chief of Mental Health and Recovery Services at the Healthcare Agency, to speak about locally what are the programs that we have. And then we'll open it up for questions. Is that okay? So as everyone talked about, this is a crisis in America, and in fact, since 2020, every day there are over 150 Americans die from overdose on fentanyl. So that's an important number to know. Secondly, the potency of this illicit drug, especially of this pharmaceutical product. I have to say that because it is an approved medication by the FDA for certain use, and that is for extreme pain as well as for cancer patients. It is used commonly post-surgical procedure for a very short time to help people to go over the acute phase of pain. But clandestinely produce fentanyl, secretly and illegally produce fentanyl, it has far more reach, and it started out with illegal activity, not only from the illegal producers, but also from folks in the medical industry as well, right? Physician over the prescribing it, pharmacists, etc. So it can be abused in all kind of way. Can be injected, snorted, smoked, taken orally by pills, or spiked into blood paper. The important thing is what is the effect of fentanyl on the brain? Just like heroin and morphine and other opioid drugs, fentanyl works by biting a part of the brain that actually control pain and emotions. And so when you take fentanyl, the effects include extreme happiness, right? And that's why it get people hooked on it very easily. Could cause drowsiness, nausea, confusion, constipation, and a problem with breathing. People who are addicted to fentanyl, if they stop using it, they experience very severe withdrawal symptoms, more so than other type of opiates. And that's why it makes it very difficult for people to stop. And some of the withdrawal symptoms include muscle and bone pain, even though you never had pain, but you use fentanyl and then you suddenly stopping it. That's the number one complaint that people have. You have sleep problem, diarrhea and vomiting, cold flashes, and goosebumps and severe cravings. That's the problem. And we don't have much pharmaceutical product that treat the cravings for any drug, let alone fentanyl. So that's why it makes the addiction and treatment for fentanyl a bit more difficult. This is important for parents as well as kids, especially kids who go to parties and where this kind of drugs are being passed around the party, to understand and know the signs of overdose, right? This is something that you would need to look for if you suspect somebody who's having trouble because they're overdosing on fentanyl. And that is they will have small and constricted pinpoint pupils, falling asleep or losing consciousness, slow, weak, or difficulty in breathing, choking or gurgling sounds, limp body, cold or clammy skin, that's very important, and discoloration in their skin, specifically on their lips and their nail beds, right? So it look blue or pale. So how is fentanyl addiction treated? There are, we know that they have to not only take medicine, which have a very limited repertoire, but therapy as well. And the social support, that's the piece that I think personally is very important, because in the treatment side, we always talk about taking medicine and therapy, but the family support and the community support is very, very important. So in terms of medication, there's buprenorphine and methadone and naltrexone. Those are some of the medication that can prevent people from relapses. Counseling is very important. As I mentioned, Dr. Kelley is going to tell us what program we have locally to help people. Contingency management, and I hope she's going to talk about it. We know that's very important and very effective, and that is using a voucher-based system, giving patient points based on negative drug tests, right? In December of 2018, the FDA cleared a mobile medical application called Reset to help treat opioid use disorder. And this is a prescription, so your physician can prescribe it. And this medical application has cognitive behavioral therapy through the technology to help people, and then also offering treatments such as buprenorphine and contingent management. But most importantly, remember earlier I talked about the withdrawal syndrome. Since this last few years, the FDA now has approved a medication called lofexidine, which is a non-opioid medicine that's designed to reduce the opioid withdrawal symptoms. And then there is a device called NSS2 Bridge, which is a small electrical nerve stimulator that you can place behind the person's ear, and that can be used to try to ease the symptom of withdrawal up to 5 days. Then what we often hear is that kids in a party and they see someone who going through overdose and having behavior change and what have you, and what they're afraid is to call for help and they don't know what to do. So that is very important, is that please call 911. You cannot be worried about, well, will I be busted? Will I be arrested, right? That person's, the person who is experiencing the overdosing symptoms, life is most important at that point. So there are 5 things that you should do if you're suspecting somebody is overdosing. Number 1, call 911 immediately. Let me repeat that. That is really, really important. Call 911 immediately. Administer naloxone, and I know Mr. Holtzman is going to talk about naloxone in a minute. Try to keep the person awake and breathing. And number 4, lay the person on their side to prevent choking. And number 5, stay with that person until emergency assistant arrives. Because the other thing, what we've seen people do is they call 911 and then they run away because they were afraid that they're going to get in trouble. So let me repeat that. 5 important steps that you need to do. Call 911, administer naloxone, which is widely available, and Mr. Holman's going to get into that. Try to keep the person awake and breathing, lay the person on the side to prevent choking, and stay with that person until emergency comes. So, points to remember: addiction is a medical condition. I cannot stress the importance of that, is that addiction is a medical condition. Treatment works and recovery is possible. And in terms of treatment and prevention, the NIDA, the National Institute of Drug Abuse, has 10 really good evidence-based strategy to help us. And I'm hoping that that's something that we can talk to you and the Board of Supervisors to ensure that we have all of the evidence-based practices here in Orange County to help us prevent the opioid overdose. Number one, targeted naloxone distribution, which we'll talk about. Number two, medication-assisted treatment, as well as medication-assisted treatment in the criminal justice systems settings. And you've heard Sheriff Barnes talk about how the correctional health services, which under healthcare agency have been working hand in hand with the sheriff department to provide that treatment in our jail. Academic detailing, and that means talk to the physician who prescribed this type of pain medication and let them be aware of the issue of fentanyl on the street, and also the prescribing pattern that you can prescribe naloxone together when you need to use this medication. Eliminating prior authorization requirement for medication for opioid use disorder, screening for fentanyl in routine clinical toxicology testing, 911 Good Samaritan laws. People need to understand that piece that I just mentioned earlier is that if you see somebody overdose, call 911 and don't worry that you're going to be arrested, right? Naloxone distribution in treatment center, initiating buprenorphine-based MAT in the emergency departments, and number 10, syringe services programs, and I know that is a very controversial here in Orange County, but it is listed at one of the 10 evidence-based strategy for prevention of any addiction. So with that, I would stop and ask Dr. Kelley to share with you our program that we have currently in Orange County. Thank you.
Okay, thank you. Thank you so much for that. Yes, not all strategies that are good elsewhere are good in Orange County, but we will hear from Dr. Kelley at this time.
Hi, good morning, and thank you so much, Supervisor, for the opportunity to be here this morning. I'm going to talk about what Mental Health and Recovery Services does to address prevention, treatment, and recovery supports. So we provide all of that to the people of Orange County, as well as for people who have Medi-Cal. We serve about 45,000 unduplicated people a year. That means we count them only once. And of those in this last fiscal year, 7,708 of the folks we served had a substance use disorder as their primary reason for seeing us. Of those, 34% had an opioid use disorder. We provide our services through our county clinics, through our contract providers, as well as through community coalitions. And as Dr. Chau stated, addiction is a chronic relapsing disease of the brain that impacts the memory, the motivation, and the pleasure centers of the brain. Next slide. So prevention. Every county in the state of California has to have a 5-year strategic prevention framework, SPF. That is a 5-year plan to address prevention needs of the county, specific to the county, as you just pointed out. MHRS's current SPF prevention plan addresses the years 2017 through 2023. We're currently gathering data for our next 5-year plan. That plan is available on our website and is easily accessible by the community. This plan ensures that federal substance use prevention and treatment dollars are received by the state of California and subsequently by each of our counties. The funds are categorical that we receive, and they have to be used in very specific ways for specific populations. But when we created this plan, we use very specific data elements. This is all based on data we have. So we use our circumstances of last drink or last drug use. We use our driving under the influence data. We do key informant interviews with people who are living with addiction, who are in recovery, from our students, from our parents, from our faith-based organizations and law enforcement partners. We utilize the California Healthy Kids Survey that's provided to schools in this county and throughout the state and nation, but the CHICS data is specific to the grades 7th, 9th, and 11th. We pull information from the State Department of Public Health opioid dashboard data to look specifically down to the zip code in this county of where opioids are, where ODs occur, and how many prescriptions are being written. We also work very closely with the Sheriff's Department here on data for morbidity as well as mortality. The focus of our report is on consumption, contributing factors, consequences, and capacity we need to build out. Next slide. So we address 3 drugs currently in our current plan. alcohol, cannabis, and prescription drug misuse, which is specific to opioids. And when we looked at the data, and an interesting thing that we asked all 11th graders as part of the CHICS data a lot of questions, and one of them asks, in the last 30 days, have you misused prescription drugs to get high? The national data says 5% of 11th graders say, yep, in the last 30 days I've misused prescription drugs to get high. California's average is 4%. Orange County's average is 3%. But when we look at each of our school districts that are reporting, Laguna Beach Unified reported 9% of youth are reporting. So this is self-report by youth. Los Alamitos Unified reported 7% of those youth said, yep, in the last 30 days, I misused prescription drugs to get high, and Capistrano Unified was 5%. Those are school districts that we focus our prevention activities on. Next slide. We look at risk factors because, to your point earlier, we have to address prevention. So while we are busy pulling people from the river, we need to know why are they in the river to begin with. So risk factors, the availability of prescriptions. If you look at a county our size, we have about a third of all the residents of this county get a prescription for opioids. That's a lot. So we look at the availability of prescriptions, the amount of opioid prescriptions, because we know that there are other dangerous prescriptions written, in particular for benzodiazepines. And this is the most important for our youth, the low perception of harm, that it's not going to happen to me. That aligns as well with developmentally. Adolescents are supposed to, this is what they do. They think they're invincible, as Chief stated, and they don't listen to adults. That's their job, is to pull away from us. But it is a huge risk factor. But we also look at protective factors. We have systems in place to monitor prescriptions. Our California Utilization and Review Evaluation System, CURES, is where every doctor who prescribes an opioid has to enter it into the system, so that if I'm doctor shopping and I'm at my 5th doctor for the day, they put my name in to write a script, they see that I just had 4 other, so they won't write the prescription. That has really tightened things up. Another protective factor is regulations and recommendations in place. Safe prescribing practices, so physicians, especially in the emergency departments, know what to do and what not to do. Another protective factor is our national, state, and local awareness campaigns. We are doing that here. This is one of these avenues, and we are very appreciative for this opportunity. We continue to do this in different forms throughout our county. Education to decrease access. That means we have to remind folks, in April, there's a National Take Back Day, that we monitor, secure, and destroy our prescription drugs. We all do that when we have a certain age youth in our homes and we lock up our alcohol or we place it somewhere else. We don't do that with our medication. That's in the medicine cabinet. Anyone can come in and get that, and they do. And finally, as Dr. Chau mentioned, supportive relationships with adults beyond your immediate family. This is so important, and those relationships, the big ones, occur in our faith-based organizations and communities as well as at school. Next. So our prevention providers do a lot of things. Prevention services are directed towards youth in our schools, but they're also directed towards adults, and especially our older adults who are at high risk for opioid use. Specific campaigns for each of these age groups, because a campaign for adults is very different than a campaign for youth. Remember, this is your brain on drugs, was not real effective. Educational workshops so that health professionals are able to identify substance use disorder, substance misuse, and that we can empower them with prevention strategies. And then youth-led activities to decrease access. And we often talk about nothing about us without us. Youth know how they want to receive information, and we need to listen to them so that they'll receive it from us. Next slide. So we know prevention works, and we also have it that we're doing it in addition to those things via our community coalitions. So we work with 9 community coalitions in the county. We also work with Orange County Friday Night Live programming. That's in 33 of our Orange County chapters are in schools, communities, and faith-based organizations. And Project Faith in Youth is active doing prevention for substance use in 30 faith-based organizations throughout our county. Additional prevention programs, NCAD, the National Council on Alcohol and Drug Dependence, Orange County. We have a program for prescription and over-the-counter drug misuse and prevention, and that targets youth, parents, teachers, and the community. That's countywide. Orange County Department of Education, we work closely with them for prevention in schools, in addition to Friday Night Live, Project Alert, and Power of Youth that targets youth, parents, and teachers. That's also countywide. Waymakers, a community provider, assist with community campaigns and alcohol and drug-free youth activities. They address youth, parents, teachers, community, and are in the cities that are listed on the slide. Providence and some of our other hospital partners who do community awareness, parent and youth education, and community coalitions themselves. And of course, the Orange County Sheriff's Department, where we are supporting them and trying to figure out how to fund some of their school and community educations that are specific to youth, parents, and community. Next slide. But treatment works, and that's what we provide. The drugs of choice for people who are in treatment, who are adults, who are in treatment with us for their addiction. Number one drug of choice is methamphetamine, followed by heroin, cannabis, and then other opioids, and that's where fentanyl lies. For youth, drug of choice, cannabis is their number one drug of choice for those in treatment, followed by methamphetamine, alcohol, and then opiates. We have, as I stated, county clinics and contract providers at all levels of care. We have 11 residential treatment facilities in our county, including perinatal programming, where women can bring who are pregnant and or parenting, can receive care and also bring their children into treatment so we can break the cycle there. We provide outpatient services in about 20 different locations, medicated assisted treatment provided through 7 different providers, recovery residences or transitional housing, so they step down from residential. It's not a sober living. They have specific programming and urine screens that are involved in that, and we have 7 of those in the county. But success is not just about being drug-free. Sobriety is not all of it. Success in treatment also results in a lot of other positives. We have seen a 53% sobriety rate for people 1 year out of treatment. That is amazing. We also have seen a 65% reduction in folks being rearrested compared to when they came into treatment, a 74% reduction in incarceration, and a 78% reduction in going to prison to do that time. We have a 107% increase in employment for people who receive treatment, 32% reduction in unneeded emergency department visits, a 42% reduction in inpatient stays, 52% fewer family conflicts, 32% increase in drug-free social activities, and a 29% decrease in homelessness, to your other point about the nexus between addiction and homelessness.
So I don't want to cut you off, but our Assemblywoman has to get on at 10:45. It's now 10:38, and I want to make sure that I get some questions that I have answered, so I'm going to intervene here. Fentanyl is the #1 cause of death among children in Orange County and among the deaths investigated by the coroner. Coroner only investigates a portion of the deaths. Can you address that, either Dr. Chau or Dr. Kelley, as to why are the fentanyl deaths not showing up on the coroner's data, or it does not appear that they are showing up?
So I think I wish Sheriff is here to answer that question on how the coroner would investigate certain percentage of death. But I think if death is in the hospital, so it could be I have overdose, and I got admitted to the hospital, and then I finally would die from organ shutdown, what have you. That's reported differently from the physician in the hospital. And so you're right, the number could be an undercounted number. Depends on where people die.
And based on what the sheriff shared with us earlier, that might change in the future because they're going to be investigating those overdoses. Right. Okay.
And we are working very closely. Before the pandemics started, we was getting ready to collaborate with the sheriff to really look into causes of drug overdose and suicide and go upstream and figure out what happened prior to that incident so we can create appropriate prevention program. We're going to restart it now.
So I have another question, and this, I think Dr. Kelley or Dr. Chau can answer this question. In the community with the Network for Homeless Solutions, BridgeNet, a whole variety of service providers, nonprofits, faith-based leaders, just volunteers who are out in the community trying to help people move from the streets and parks to housing. There is a common concern that the number of addiction treatment beds are full in Orange County. And so what is your response to that? What do we need to do as a county to provide for more treatment beds? And when I ask that question, I don't mean more, residential sober living homes. I'm talking about medically staffed professional treatment beds in appropriate locations, not in neighborhoods. What is the status of treatment beds in Orange County? Do we have enough? And if not, what are we doing to address that gap?
So I would just say we don't have enough. And the ones that we do have might be outpriced, if you will. There's the commercial side, and then there is the public side. In the public side, and I can only speak for the public side, although I've participated in receiving services for my children in the commercial side. On the public side, we are staffed by professionals. We have very specific requirements. We have to have a medical director. We have to have nursing staff. We are staffed by professional alcohol and drug counselors who are certified and registered in the state, as well as licensed practitioners of the healing arts. We need more, and we need to increase funding for that. The amount of funding that we get to sustain what we need is minuscule. My budget is about $500 million. 10% of that is allocated for a substance use disorder. And we know that the state is trying to change that to make it easier for people to access services, but also remember that for us, that's the Medi-Cal population we are serving, as well as anyone who has no insurance or doesn't have coverage for whatever reason that might be, and we are still providing those services. We do need our private partners to come to the table.
Okay. I have one last question, and I need you to answer it in 2 minutes. We heard about marijuana being the number one chosen drug by, well, I know some people don't think it's a drug, but marijuana use is, youth are using marijuana more. And then we heard the sheriff talk about how marijuana is being laced with fentanyl. As we start to, as a community, allow for more marijuana dispensaries, what is environmental health doing to ensure that these dispensaries are protecting the consumer from fentanyl-laced marijuana?
That's a great question, Supervisor. I don't know if our environmental health is actually regulating the dispensary, so I will get back to you. And if we're not, then we need to figure out ways so that we can have some monitoring. I guess that's what you're getting at. So
Right.
I appreciate that. I think that's what we should do.
Okay, thank you.
Thank you, ma'am.
Well, I want to thank you both for attending today and providing this information for our community. Mr. Holtzman, we are going to put a pause on your testimony as we hear from our Assemblywoman, because she has another hearing that she has to attend to. We want to make sure we hear about what her legislative work is that she's working on. So at this time, I'm going to move to introduce Assemblywoman Cotty Petrie Norris. Oh, we're going to pause. I apologize. We're going to pause for 1 moment before, so we can switch over. Thank you both, and if you could stay around, we might have other questions.
We'll stay around.
Cotty Petrie Norris. So, thank you.
We need to like time it back.
Okay.
Hang on a second. All right.
Okay, thank you for that pause and a little technical change. So at this time, we will hear from Assemblywoman Cotty Petrie Norris. Assemblywoman Petrie Norris serves as California's State Assembly member, and she's been a champion of reforms to protect our community from fentanyl. Last year, she championed AB 1351 to reclassify fentanyl as a Schedule I drug like cocaine and heroin. This is exactly what we heard from Sheriff Barnes earlier in our hearing. The County Board of Supervisors unanimously supported this legislation. While this legislation did not pass, we are grateful for Cotty's leadership and look forward to her next steps on this critical issue. And at this time, we'd like to hear your thoughts, Assemblywoman, as to what can we do at the state level to address the fentanyl crisis here in Orange County and throughout California. Welcome. I think you just can begin speaking.
Good morning. Good morning, Supervisor Foley. Good morning, Chairman Chaffee. I want to thank you for convening today's hearing on the fentanyl crisis. It's an incredibly important and urgent topic. And I also want to thank all of the panelists we've heard from this morning. And in particular, I want to thank you, Sheriff Barnes, and you, Chief Lawrence, for your partnership and your leadership on this issue, and for your tireless commitment to keeping our communities safe. Supervisor and Chairman, as you've heard today, the scourge of fentanyl is poisoning our communities, killing our kids, and wreaking havoc all across the state of California. Fentanyl is one of the most dangerous and deadly substances in the world. Just 2 milligrams, that's 2 grains of sand, is enough to kill, and kill it certainly has. Right here in California, more than 10 Californians die each and every day because of fentanyl. And in the last 3 years, fentanyl-related deaths have spiked by more than 500%. And I think it's so important for us all to remember that these are not just numbers. They're not just statistics. These are people. These are lives who have been lost. They're our loved ones, our moms, our dads, our brothers, our sisters, our daughters, and our sons. What we are seeing with the fentanyl crisis and the fentanyl epidemic is that fentanyl is different than other drugs. And therefore, our approach in how we deal with fentanyl must be different. And that's why I am proud to have partnered with the Orange County Sheriff's Office and with Sheriff Barnes on legislation AB 2446, which will target traffickers who are responsible for the fentanyl crisis and responsible for all of these tragic and unnecessary deaths. And just briefly, 2 particularly disturbing trends have prompted me to introduce this bill. One, drug traffickers are increasingly deceptively cutting counterfeit prescription medications, things that they're selling as Xanax, oxycodone, Percocet. They're cutting it with fentanyl, which exponentially increases poisoning risk and recklessly threatens our public health and safety. In September 2021, this disturbing trend prompted the DEA to release a warning about the sharp increase in fake prescription drugs containing fentanyl. The second thing that we have seen, the second disturbing trend, is that drug traffickers and dealers are increasingly abusing social media platforms to sell fentanyl to our kids. We're seeing the illegal drug trade booming on social media sites and apps. Drug dealers no longer need to stand on street corners to sell. Now they are connecting with young people on platforms like Snapchat, Instagram, and messaging apps like WhatsApp. We're seeing a tragic and escalating number of cases where young people are dying of fentanyl poisoning after consuming a substance that they were misled to believe was something else. And I want to take just a moment to tell you about Alexander Neville. Alex was smart, sensitive, curious young boy. Just like all of us and all of our kids, he was struggling to navigate the strange and difficult times of the COVID-19 pandemic. One evening, Alex took what he thought was an oxycodone tablet that he had purchased from a drug dealer on Snapchat. The next morning, his mom tried waking him up for a dentist appointment, and Alex was unresponsive. He was later pronounced dead at the hospital. Alex had his whole life ahead of him. He was killed by fentanyl poisoning. Alex was just 14 years old. That is the same age. Alex was the same age as my son. As a mom, stories like this terrify me. And as a legislator, I am determined to partner with all of you to act so that we protect our community. And I have, as I said, introduced AB 2446, which seeks to stop more fentanyl at the source. Just briefly, in terms of what our bill will do. First, the bill establishes that the possession of 2 grams of fentanyl is a felony. To put it in context, 2 grams is equivalent to 1,000 lethal doses of fentanyl. Secondly, this bill will close a loophole in the law and appropriately align fentanyl analogs as Schedule I drugs. In addition, the bill will add additional enhancements for selling fentanyl in areas around children and add additional enhancements for selling fentanyl on social media. We'll also establish that the distribution of fentanyl resulting in death will carry a maximum penalty of 20 years to life. The bottom line is that we have got to act in order to ensure that those who are profiting from the fentanyl crisis know that there are consequences to poisoning our children and know that the punishment will fit the crime. And I will be frank and upfront and note that there is a reluctance in the legislature right now to support penalty enhancements to address this issue. This is understandable. We've learned from the experience, the lessons of mass incarceration. I want to, though, distinguish that this bill, this legislation, is not going after addicts. This legislation is going after the traffickers and the dealers who are killing our kids. We know that addicts don't belong in jail. Those suffering with addiction need rehabilitation and care. But we also know that we need to strike the right balance between rehabilitation and care for those who are struggling with addiction and firm, decisive penalties for bad and evil actors who traffic with these deadly drugs. And my bill, I believe, will complement California's increasing investments in addiction rehabilitation. Lastly, I want to note Supervisor Foley and Chairman Chaffee. I believe that alongside our legislative efforts, we need to dramatically raise awareness in our community about the dangers of fentanyl and the prevalence of fentanyl, especially with our teens and our parents. I'm working with the sheriff's office, school districts, and social media platforms in order to put together a county-wide education campaign, and would really welcome your partnership on this initiative. As we've heard in today's hearing, there can be no doubt that the fentanyl epidemic is an urgent public health crisis. And there can also be no doubt that we must act swiftly and with urgency to stop these tragic deaths. Thank you again for your partnership and your leadership on this issue. Look forward to continuing to work with you to protect our community and to protect our kids.
Thank you, Assemblywoman Cotty Petrie Norris. And, you know, as a mom of college age boys, and you're a mom of junior high age boys, between the two of us, sadly, We know far too many families and other moms who have been impacted by fentanyl and the opioid crisis. I personally have a mom that I know whose son thought that he was taking a Xanax with his girlfriend, and that Xanax was laced with fentanyl, and the boyfriend and girlfriend embraced each other and went to sleep, and sadly were found in the morning dead from the overdose. So we cannot work more urgently, as you say, to address this and to hold those who are responsible for poisoning our community accountable. So thank you, and you can count on us to support your initiatives. And what can we do as a county to support this legislation that you have pending? And will this be in this current cycle? Oh, did she leave? Oh, okay, well, I'll ask her when I talk to her tonight. Okay, well, there we have it. Okay, that's what happens when you're trying to include people who are working hard in Sacramento on our behalf. Okay, so next we're going to go back to Mr. Holtzman, and we appreciate your patience.
You have Senator Bates on the line.
I thought I wanted to do Mr.
That's
Holtzman.
okay, but just saying.
Okay, well, we will move to Senator Bates, and we'll get back to Mr. Holtzman. We appreciate that you are so patient and willing here to wait so that we can accommodate our legislative partners. So at this time, I'm going to introduce Senator Pat Bates. Senator Bates serves as California State Senator. She worked with Assemblywoman Cotty Petrie-Norris, who we just heard from, to introduce SB 75, which is the companion legislation to Cotty's AB 1351 to reclassify fentanyl as a Schedule I drug. Thank you, Senator Bates, for taking the time to testify with us here today. And Senator Bates, can you hear us? I think if you just begin speaking, there's a little bit of a delay, and we'll be able to capture your testimony. Senator Bates, can you hear us? Go ahead and begin speaking.
No, I can't hear you.
Oh, there you go. We can hear you. Go ahead and begin. We can hear you if you want to go ahead and begin.
It's not working. It should get my camera on, and I can't hear them, nor can I understand the camera. And I have the video on, and I have the mute off, so I'm not quite sure. Hear you. Can you hear me?
We can hear you, Senator Bates. You can go ahead and begin.
Okay.
Yes, we can hear you.
Well, thank you for inviting me to participate this morning in this hearing. A great big thank you to Supervisor Chaffee and Supervisor Foley for co-hosting this. So very important, so very important. I'd also like to thank our Sheriff, Don Barnes, and Dr. Chau for their work on this issue. I was not able to hear all of their presentation, but I've heard some in the past. They do an incredible job bringing this very, very important public safety issue to the forefront and increasing the education and the knowledge of what unfortunately is going on in our communities. During my time in the legislature, I have made fentanyl one of my top priorities. As we know, people are being killed. It is a poison. And we heard, I think, a very, very good analysis and comprehensive discussion of that from my colleague, Assemblymember Cotty Petrie-Norris. As a former social worker, I did work in communities back in would be in the early 70s and 80s. I worked in communities that were ravaged by drugs. I witnessed firsthand the devastating effects of addiction that can have on families. And in those days, the drugs of choice were heroin and LSD. Fentanyl, as we know, is so much more dangerous. So getting the message out to the public, to our kids, to parents, to grandparents, teachers and coaches is really imperative. They need to know that one pill can kill. And I think that's been the tagline that Supervisor Foley put on this. And it's so very important. It really hits home on exactly what this is about. Obviously, we need to do more than getting the message out. And that's where we legislators have tried over the course of several years. I began in 2016 and pursued it every year since then. While we haven't been successful yet in our efforts to address the illegal fentanyl trade, we do keep trying. And I think that's what's very important for our public to know. I think all of you as legislators or certainly policymakers understand that sometimes you have to keep working at it, and it finally catches on. And we hope maybe this year it will, as we've seen the incredible increase in the deaths among our young people from this poison. I'd like to quickly go over a few of my bills so you understand the direction I'm taking this year. I started in 2018, by the way. I worked with San Diego County District Attorney Summer Stephan to author SB 1109. That increased the education for young people, student athletes, about the risk of addiction and overdose from prescription opioids. It clearly set forth how quickly our young people can become addicted. So this year I've begun to expand the education arm of my legislative reach. For the 2022 legislative session, I've introduced SB 904. This will clarify the standards of controlled substance education programs and treatment programs for probationers and inmates. As you know, California, just the opioid settlement of $20 billion is going to send a significant amount of money to our state, but to our state government in particular, we are supposed to receive about $86 million, and our governor has indicated in his press conferences that he intends to direct about $53 million of that directly to education for our young people. So that is putting us on a very, very important path. I am hoping that the funds that come from that will help me get SB 904 approved. I have also introduced SB 1053. It amends the penal code and broadens the definition, clarifying that any person who sells, furnishes, administers, or gives away a controlled substance has personally inflicted great bodily injury if the user suffers an injury using the drugs. This helps clarify what happened with a judgment saying that if a person has to personally administer a drug for them to be guilty. So this actually broadens that. SB 1053 also amends the Health and Safety Code to provide a 10 and 20-year enhancement if the sale or furnishing of a narcotic containing fentanyl results in serious injury or death. And we're talking about sentence enhancements. Assembly Member Cotty Petrie-Norris did mention that sentence enhancements are not real popular in our legislature at this time. But I think that our constant education and bringing the issue forward, that this is one arm of the solution that's needed, that people know if they are involved in the trafficking, the distribution, the administering, the selling, the marketing, they have serious penalties they're going to face. And so I've introduced SB 1060 to combat trafficking and distribution of the lethal narcotics in our community, obviously fentanyl, but this time it's very similar to the one that didn't pass the last time, but we have now included oxycodone because it is the agent that they're using these days to put fentanyl in that. And so it does have a new sentence enhancement, and you may know that to reintroduce legislation that we had in the first year of a session, there has to be some change to it to have it heard again. I did feel in our Public Safety Committee last year that there was now a more of an acceptance, let's say, that we've got to be doing something legislatively on the issue of fentanyl. So I'm hoping that this one will fall on better ears this time. Last year, my colleague, Senator Melissa Melendez, authored SB 350, and that was to recognize the situation that took the life of Alexandra Capoletto, who consumed 5 times the lethal amount of fentanyl in one of those opioids. It's very important because it planned to address implied malice for drug fatalities, similar to what is in place for fatality caused by a drunk driver. By advising a defendant of the dangerousness of their conduct upon conviction, an offender is both deterred from such future conduct and conceivably exposed to greater accountability in the future should they offend. The bill would have required the court, and I say would have because it was not successful, but it raises the issue again, requiring the court to advise the person that partaking in any of those illegal actions could cause a fatality if he or she continued to do so, and it would have provided understanding for those convicted of those crimes that their actions could result in the death of another human, ultimately leading to a homicide charge. And I don't know if our district attorney has discussed that in the panel yet, because I haven't been able to hear, but he may want to elaborate on that if he hasn't. Without SB becoming law, I know that our district attorney has discussed providing similar advisories in future cases. Unfortunately, bills focus on protecting the public and providing real consequences to the criminals who are involved in this. Those bills get killed every time they're in our public safety committees. The Assembly Public Safety Committee had kind of an interesting tagline. It was called the Boneyard, because nothing comes out of there that has sentence enhancements in it. So it does prevent the public, frankly, from being able to have an opportunity to weigh in the debate. It also never reaches the Senate or the Assembly floor. And if they were debated on the Senate and the Assembly floors, the public could lobby their respective legislators in a more effective manner to support good public safety bills, because fentanyl has taken the lives of too many people, and I think that's starting to resonate out there. I am reminded of Alex Neville. I know that Connie Petrie mentioned Alex. He is a resident of my district, and she mentioned he lost his life at just the young age of 14, devastating his parents, and I would say devastating our community, knowing that this poison is still out and about and circulating amongst our young people through the administering of these opioids that are laced with it. Deaths like Alexandra's, they are tragic and unnecessary. So for the remainder of my time in the state Senate, and I will be completing my term this year, I will continue to push for policies and work in our community with the various agencies and the nonprofits to stop drugs like fentanyl from spreading into our communities. And I mention that because we have to give a high five to our volunteers in the community who have really weighed in many of the opportunities I've provided them to provide that education. And I certainly will be walking hand in hand with them when I am back in our community. So thank you again, supervisors. I really applaud you for putting this together, giving us an opportunity from Sacramento through this Zoom to provide our perspective. We will continue to work. You never, ever give up on situations like this. You have to be warriors, and I know all of you at the county level are, and certainly those of us up here who continue to provide you with some more tools, certainly consider ourselves warriors in this war against drugs. So thanks again.
Thank you so much, Senator Bates. And since we're having a little bit of technical difficulty, I think we'll skip on the questions, but thank you for presenting, and thank you for partnering with Assemblywoman Connie Petrie Norris to support legislation that can hold accountable those drug traffickers who are impacting our communities in such a negative way and killing people. So let's not forget that. Okay. I'm going to move now because I think that the district attorney's office is not yet online, right? Okay, so now for sure I am going to call on Mr. Holtzman. Let me just briefly introduce Mr. Holtzman. Matt Holtzman serves as the chair of the County of Orange Behavioral Health Advisory Board and chair of government relations for NAMI Orange County. He is a longtime advocate and community leader on issues of behavioral health. And thank you, Mr. Chairman, for joining us here today. I served with you when I was the board's liaison to the Behavioral Health Advisory Board. And during that time last year, we talked a lot about naloxone and how we can better distribute that within our community. And so we hope to hear from you today about what are some recommendations that both you and the advisory board have for the County Board of Supervisors to address this issue.
Thank you very much. I'll start out and describe what we do at the Behavioral Health Advisory Board. We are the voice of the community. So we speak for the individuals with illnesses, with mental illnesses and addiction, with the co-occurring disorders. We speak for the families, we speak for the community itself, and we speak for a lot of the providers as well. So we try and get a balanced voice and a well-conceived action plan and advisory ability to the Board of Supervisors. Speaking as that, I am a family member, I'm an advocate, and I want to first thank you for being here. And I would say that I have seen the toll of addiction and mental illness. My stepson died by suicide while addicted to heroin. A stepdaughter has been through 7 or 8 recovery programs at the cost of hundreds of thousands of dollars. She was in the county jail for a year, and she was given the option of going to the Salvation Army program or 19 years in the state penitentiary. So she went through the Salvation Army program. She has been clean for about 2 years now. She's on probation. She has to stay clean for another year. But it is a horrible disease. My own daughter died of addiction-related illness on December 5th of last year. So I have a dog in this hunt. And while the county has been working hard to address the COVID crisis and has done a great job, we're being slammed now with the fentanyl crisis. That is just as deadly. In 2019, the county coroner's office reported approximately 432 deaths by overdose, most of them involving fentanyl. And one of the problems that we did not get to in some of the questions before is that toxicology tests take months. There's a huge backlog, and this is why a lot of the statistics are not up to date. So we look at them and we have to take them as a 6-month lagging indicator. And in the period from April 2020 to March 31st, 2021, the number of overdose deaths rose over to 700, primarily, again, involving fentanyl. And the predictions for this year are dire. So the horse is out of the barn. It's the leading killer of children under 17, and the dealers are adding it to every counterfeit prescription drug they can find. They're adding it to marijuana. They're adding it to cocaine, etc., as you've heard. And all it takes is a pill press and something to cut it with, and they'll be making fentanyl pills that they get out on the street. And the labs are in Newport Beach or Costa Mesa or South County, wherever someone has a pill press. And every dose can be a killer. Every now and then when a death or deaths are horrific, we read about it in the papers. Otherwise, the epidemic is largely unnoticed. This has to change. I went to college in New York City and lived near a place called Needle Park. They made a movie about it. It was the hangout for heroin addicts. In 1976, when I lived there, 6,000 people across the United States died of overdose. In 2021, it was over 100,000. Obviously, we're doing it wrong. Overdoses also don't happen in police cars or ambulances. Sometimes they are too late to the scene. And as you've heard from several witnesses today, they have found young children who went to sleep and never woke up. They happen at home and behind 7-Elevens and on the street and in shelters and even in the treatment programs in sober living homes. This is where we should focus much of our effort. The Solace Foundation has distributed thousands of Narcan kits, but we need to do much, much more. And I brought one with me. It takes about 5 minutes to teach someone how to use this. It's very, very simple. And there are tutorials on YouTube, on Facebook. They're all over the place. This isn't rocket science. This is something that you can teach people very quickly. And as a matter of fact, I carry a bunch of doses with me in my truck when I go around the county. And if I see a homeless person, I'll pull over. And the first question I'll ask is, do you know what this is? And a lot of times they'll already say yes. So if I know that they know what it is, then they probably know how to use it. If they don't, I teach them. So we're trying to get down to the street level here. But we need to prepare more, and we need more people involved. Some suggestions for direct action. We need tens of thousands of Narcan kits with available training. We need test strips, because when someone buys a product, they should be able to test it before they use it for fentanyl. I think that's critical to reducing deaths. We need to educate the homeless and distribute Narcan among the homeless. They can't get high from it. It's not something that is something that they're going to be able to sell on the street. Hopefully they'll keep it with them, and if they see someone else who's overdosing, they may end up using it and saving a life. We need to educate the staff and residents at the shelters. We need to educate families through the schools and churches. It's amazing. And what I see in much of our education programs is that we're preaching to the choir. So we're talking to people who've either lost a family member or have friends who've lost a family member, but we have to get this out into the community. And one of the things we're going to do as the Behavioral Health Advisory Board is we have a table at the Swallows Parade on March 12th, next Saturday, and we're going to have Narcan education there. So we're going to try and get out into the community to community events to teach people about the dangers of fentanyl and how to treat overdoses. We need mandatory drug overdose and awareness events in the schools. And we need Narcan education availability in college dorms. We need it in nightclubs. We need it in bars. We need it at parties. So this is where we have to go. This is a street level issue. This isn't something that we can look from top down and basically help try and solve a problem. We're here, this is first aid. We need to ensure every school nurse is educated and has Narcan. A lot of kids have been overdosing in the schools. We need city and county events calling attention to the problem. We need a mass communication program. We need TV and radio ads, and we can cooperate with other counties on that. We need bus shelter ads. We need billboards. And if you look at the screen, I saw this in November in the Fairfax district up in Los Angeles. And some people got together, they got a wall, they got a graffiti artist, and they put that up. And that is a very powerful message. Fentanyl be killing our friends. We need handouts at community events. We need public speakers. We need banners on public and private buildings, especially schools. And we need leadership. I have yet to hear a lot of our local electeds speak down, and you've been right in the forefront of this, Katrina, and I really appreciate that. But we need more of them. This plague affects all of us, regardless of race, creed, ethnicity, or sexual orientation. As a matter of fact, the crisis affects minorities and marginalized populations even more than others. And if we want to get to the heart of the matter, we have to have better treatment on demand. When an individual with addiction is ready to go, there has to be a place for them to go. They can't wait 2 weeks. Otherwise, the moment is lost. We need treatment that works. The 28-day detox IOP and a ticket home or to sober living and go into your meetings is a multi-billion-dollar farce. And they call Orange County the Recovery Riviera. It's a revolving door. As I said, my stepdaughter went through it at least 8 times. We need to do better, and there are programs that we can find that work. But as long as there is demand, there will be supply, and we have to recognize this. Thank you very much.
Thank you, Mr. Holtzman, and my condolences. I did not know about your daughter. I'm so sorry. Okay, well, you gave us a long list of action items, and that's what I often appreciate because I'm an action-oriented person. So thank you, and we will take our team and analyze some of those action items. I'm looking forward to hearing from the Behavioral Health Advisory Board in a formal capacity as to what the County Board of Supervisors can do to address some of the gaps. And so thank you so much for being here today and providing that great testimony. Okay, now we're going to move, I believe, to, Okay, so we're moving to Mina Saeed, and she is from our district attorney's office. And is she on a Zoom or is she in person? Okay, okay. And so, is she available at this time? Okay. Okay. Okay, Ms. Saeed, can you hear me?
Yes, I can hear you.
Oh, Mr., I am so sorry. No one
That's
corrected
okay.
me.
Very
It's
common.
Mina. Okay, I know now who you are. My apologies. And so are we just having it audio? Okay, thank you. I don't see the visual. Okay. Oh, there we go. Hi, Mina. Thank you so much
Hi.
for being here.
Good morning, Supervisor Foley.
Someone
Thank you very
earlier
much.
referred to the speaker in the with the pronoun she, so I didn't know it was actually you.
No, that's okay. That's
Okay.
okay. It's a very common mistake.
Okay, I know who you are. Okay, so thank you so much for being here and for providing an update from us and sharing with us what the district attorney's office is doing as it relates to the fentanyl crisis. So I'm going to go ahead and turn the floor over to you.
Thank you very much, and good morning to the distinguished members of this panel that have already spoken. And thank you, Supervisor Foley and Chairman Chaffee, for inviting us to speak. One of the practical steps that the Orange County District Attorney has taken to help save lives, help hold dealers accountable, and address the danger of fentanyl distribution is craft an advisement that is now already being rolled out, that is now being given in, at least we're attempting to give it in every case in which a defendant pleads guilty to offenses involving controlled substances, in order to warn defendants about the dangers and consequences of selling, distributing, or manufacturing controlled substances. My intention today is to give a brief summary of the advisement, a brief overview that we've rolled out in Orange County, namely its content, its purpose, its reception by the courts, and its intended effect. We, of course, thank our partners at other DA's offices throughout the state for their input as we considered, which we considered in crafting our own version of the advisement for Orange County. Essentially, the way it works is that if a defendant pleads guilty, whether in a negotiated disposition with the people or in a plea to the court, we seek to have this advisement read so that it's reflected in the record. And the defendant, if the advisement is given, would hear and would be advised that the unlawful manufacture, sale, or furnishing of any controlled substance poses grave health risks to those who ingest it, are exposed to it, or are affected by its manufacture. The defendant would hear that in addition to the danger posed by the suspected controlled substance itself, the drug that the person thinks they're selling or distributing, that unbeknownst to the seller or furnisher, the controlled substance may contain other controlled substances that perhaps are even more dangerous, such as fentanyl, that significantly increase the threat to human life. The defendant is then warned that if he manufactures, sells, or furnishes any controlled substance, and a person dies as a result of ingesting it, being exposed to it, or its manufacture, then he may be charged with murder. The purpose of the advisement really and primarily is to inform and educate persons involved in the consumption, distribution, sale, or manufacture of controlled substances that the behavior in which they're engaged is dangerous and may lead to someone's death. And equally as important, the advisement seeks to inform defendants that fentanyl and other dangerous controlled substances may very well be present, even if they don't know it, in some other drug that they think they're consuming or that they think they're selling or distributing. And this puts defendants on notice that any drug they sell may contain lethal amounts of fentanyl. Therefore, should someone die as a result of the sale, the distribution, or the manufacture of the drugs, this advisement is also intended to serve as an important piece of evidence to show implied malice in the appropriate case. At the very least, it communicates the gravity of the warning. The purpose of the advisement, therefore, is twofold. Number one, to prevent unnecessary deaths, to save lives, to educate. But number two, also to communicate that if the defendant continues to sell or distribute or manufacture drugs and someone dies, then he may be held accountable for that death. And you'll also notice that in Orange County specifically, we've chosen to approach the advisement a bit more broadly than focusing on fentanyl alone, in order to be a bit more comprehensive and to address also the dangers of other drugs as well. We've also been working with legislators, law enforcement, and the courts in order to make sure the advisement reaches its intended audience. We certainly, starting, I believe, in November of last year, included in any negotiated disposition with the people in cases involving controlled substances. But we also seek to read it, or have the court read it, when a defendant pleads to the court. It's my understanding that many judges have permitted the advisement to be read, and where they have not, we will continue to argue that judges should permit the advisement to be given. So we look forward to work with our law enforcement partners, legislators, the courts, the distinguished members of this panel, and the public to do our part in helping to protect our community and addressing the unique problems posed by the unlawful distribution of fentanyl and other dangerous controlled substances. Thank you very much for your time.
Thank you so much, and thanks for your work in this area. Can you share with us, is there anything that you need from the Board of Supervisors to be able to continue to do the work to root out opioid traffickers and fentanyl traffickers in our communities?
I would certainly need to be happy to relay your question to the district attorney, but certainly to just continue getting the message out. The work that you're doing today with this panel is a wonderful step in that direction to helping protect our community. So we thank you for that.
Okay, and is there any legislation that the district attorney's office is particularly interested in having the Board of Supervisors support?
It's my understanding that we're currently working with Senator Bates on SB 904 and SB 1053, which she has spoken about. But beyond that, I would have to get back to you.
Okay, what about Assembly Member Cotty Petrie Norris's two bills, AB 1673, which would create the Anti-Fentanyl Abuse Task Force, and AB 2446 that she referred to target traffickers responsible for fentanyl-related deaths?
I would assume that we're also working with her on that, but again, I would have to get back to you with more information. I'm not prepared to address that at this time.
Okay. All right, well, thank you so much for sharing about the advisory process and what you're doing in the District Attorney's Office. We appreciate you joining us here today. And with that, I think that we are now prepared to take public testimony. Is that right? Okay. So at this time, we will open for public testimony. Do we have any members of the public here? Okay. If you want to go to the podium and you can present at the podium. Is there anyone in there helping?
Are you accepting public comments? Okay, please, thank you.
Is there a timer on?
You know I'll just talk for 6.
I know. Okay.
Thank you.
Go ahead and please, I know that we have members of the public here to provide testimony. If you could go ahead and please state your name and.
Did anyone else want to go? Okay. Happy day. That's for our sign language. I hope she saw that. Katrina Foley, thank you very much for holding this meeting. The first person I'd like to mention is my friend Zachary Robert Coy. He passed away of a fentanyl-related death. He was about 10, 20 feet from his front door, face down, and that was where his life ended. The sad thing is you brought in Clayton Chau. He has a criminal record. Now, a lot of times people with criminal records learn the law and become better off for it. But I don't really use this word often. He's not just ignorant, he's criminally stupid. Because he had the opportunity to inform everyone that if they find somebody who's OD'd, they can call the police and the sheriff, dial 911, and they don't have a risk of being arrested. So if you do find somebody who's in that condition, or if you're partying with somebody, call the police. It's a free ride. You're not going to be arrested. The fact that Clayton Chau did not mention that once is an indication of his ineptness. An Anaheim City Council meeting, a gentleman by Mark Richard Daniels came to the meeting and thanked the city council, the mayor. He even thanked myself and a number of other people because he's no longer homeless. He didn't need any of these drugs that Be Well and Orange County mental health facilities provide and force on people before providing services to them. As an example, Matt, he mentioned, and there's Dr. Veronica Kelley, both mentioned that they take their family to seek private help, not seeking the county help. Sean Nelson lost his seat on the Board of Supervisors and his political career because he felt the need to violate HIPAA laws by telling people that he takes his daughter to private services because the county services are that bad. It's really difficult too because 20 years ago I had a girlfriend who passed away. We had lived together for 10 years. She was taking prescribed fentanyl. Okay, so you're the same people who are prescribing these drugs, and now you're trying to say that you're going to help us stop using them. The sad thing is my attorney, who forged plea agreements and sent me to mental health, did so because she didn't want to file a motion. And I filed petitions on this, and you're still allowing county courts to force people into these mental health facilities and mental health institutions. You yourself, Katrina Foley, rather than address the petitions that I filed to you, you simply pass me off to mental health, which is where they're going to prescribe these drugs that cause and induce and encourage the fentanyl poisoning. So something really has to be done, and we're all counting on you as a mother, as a mom, as somebody who's completely different than the other 4 seats beside you who aren't there, to do something, to listen to the people when we petition you. You brag about seeing all these government officials once a month. How about meeting with the people once a month? I've been to every board meeting that you've been to, giving you the opportunity to be the voice of progress, to be the voice of change.
Thank you, Mr. K. I think there's another person who would like to speak, so thank you for your comments.
No, please, thank you. Happy day.
Okay, thank you. Good morning, or good afternoon almost.
Good morning. My name is Laura Curran. I live in Newport Beach. I want to talk about a related activity, and this is the poor quality of treatment that is provided at the residential rehab facilities, both licensed and unlicensed, and affects the broad community. So these treatments are promoted by the Department of Healthcare Services, and they allow the cycle of drug dependency to continue. And I would posit that the documented failure to supervise clients in rehab allows for the distribution of drugs, including fentanyl, to clients who were not supervised. And I say this because I live next door to 2 licensed 6 and under rehabs, which have been shown to operate with the characteristics of integral facilities. And in 2020, DHCS documented during their renewal that they had a failure to conduct over 100 bed checks in a 1-week period, so a failure to supervise. They had locations which were not supervised overnight. They had 1 person designated to serve as the supervisor for 2 facilities, which is clear evidence of integral facility. They were providing treatment to non-clients at the rehab So this facility has its headquarters in Costa Mesa. It's highly likely, as has been documented in 2018 and 2016, that people were coming from Costa Mesa over to the facility who were not residents and receiving medication. Medical personnel were allowed to operate with no personnel documentation and no tuberculosis check. Every employer I've ever worked for requires you to get a TB test. And here the doctor's documentation and TB check were not on file. And finally, we have clear evidence that the operator of the facility is now allowing another person to represent himself as an operator. We reported this to DHCS for over 9 months ago and have still not received a response. So what I would ask the county and the legislators to do is to advocate vigorously for DHCS to provide the ability for local enforcement by the county and by cities of DHCS license requirements. Also that DHCS have local enforcement personnel. Because the police spoke about the amount of time every time there's a call. Well, last Tuesday at midnight and at 5 a.m. and at noon, when there were people yelling outside my house, smoking and swearing, I had to call the police because code enforcement's not available. And we want to make sure that people are being supervised, and we just want peace and quiet in our neighborhood. So if we're talking about using resources widely, DHCS has said its only metric for effectiveness is the number of beds. As Cotty Petrie-Norris pointed out in the hearing she held in December, they are not concerned about efficacy and whether the people are actually effectively treated through rehab. So we have a responsibility to put a full court press with Todd Spitzer and with the supervisors on DHCS to allow the local agencies to enforce and to determine if operators are operating effectively, because we are considered the Riviera Rehab. And I will tell you, on my street, we're about to get 2 social rehabs which operate with over 12 people. So we would prefer that people continue to receive effective treatment, not half-baked treatment, as the gentleman also described. Thank you for holding the hearing. And I hope we have the opportunity to talk with Todd Spitzer's office as well about some of the insurance fraud that is related to this activity. Thank you.
Thank you so much, Ms. Corinne. I know that our office has been working with you, and we have sent letters to the state agency that is supposed to be managing the individual detox and sober living homes, and we've not been satisfied with the state agency's response, and we'll continue to press them. We are having a sober living home town hall in partnership with Supervisor Bartlett here in the very near future, so we'll make sure to invite someone from the state agency to participate. Okay, next speaker.
Hi, thank you for having me, and thank you for what you're all doing. My name is Jody Barber. I'd like to address this epidemic. It's actually a genocide. This is what we have going on here. Also, I'm getting the calls for help all the time, and this is a huge problem that we need to address, which we already have, but the help for these young adults and teenagers that need help, it's really, really difficult to get them treatment. A lot of them that are homeless do not have insurance. They may have Medi-Cal, but there's just not enough places that take Medi-Cal in Orange County. They need long-term treatment. 30 days isn't enough. It's just such a huge, huge problem trying to get them and find them help. Also in rehabs and treatment centers, I would love to see the MAT program in these rehabs. It is saving lives. Sublocade, that is a once-a-month injection. It stops the cravings. They get their life back in order. They get jobs. They're not on it for a lifetime, but it is saving lives along with counseling. So Vivitrol, Sublocade is saving lives. It stops that craving that they have, and they're getting their lives back in order. So I would love to see this in every rehab, the MAT program. My MAT clinic in Laguna Hills, I tell a lot of young adults to go there and get their help. They've been in treatment, it's not helping, their parents can't afford rehab any longer, so the MAT program is working. My MAT clinic, I highly recommend that place, it's very good. It's just an epidemic out here. I know, it's very, very sad, and I'm hearing of these deaths. Unfortunately, a lot of people still aren't aware that we have this epidemic, that we have these deaths occurring 14 years of age on up. The epidemic is still young adults who started with opioids from a doctor, and they have been addicted for many years, and the opioids led to heroin on the streets, and the heroin is now, it's fentanyl. They're going straight to fentanyl and they're dying. And so this is the young adults in their 30s that are dying. And it's just tragic. I lost my son, Jared, when he was 19 years of age in 2010 from a prescription drug overdose, and many of his friends. I show my film Overtaken in schools. It's in rehab centers, DUI classes, and it's hopefully saving a life. So thank you for this opportunity.
Thank you, Ms. Barber, and thank you so much for coming here today, and thank you for collaborating with our state legislative partners in the past to create reforms. I know your story, and we're grateful for you to continue.
Thank you so much. Thank you for what you're doing. Thank you.
Okay, next speaker.
Good morning, and thank you for allowing me the platform to speak today. My name is Maggie Fleitman, and I run a grief support group in Orange County since the year 2012, based out of Mission Viejo, California, and it's called Solace for Hope. We support families who have lost a loved one under any circumstance to a substance, and we also support families who are struggling with this issue. We provide a safe, non-judgmental place for families to do that. Because of the stigma, it is not easy to talk about this in the general public, to even our own friends and some of our family. Lately, and really for the last few years, I get calls and emails almost on the daily about another family who has lost a family member to fentanyl. It's pretty much fentanyl all day long. My son died from a heroin overdose in my home, and I found him in 2010. He's an older brother, and he has three younger brothers. My entire family was present in the home when this happened. This story is being repeated over and over again throughout our county every single day and throughout our nation, and something needs to be done about it. What do I say to these families when they call me and they say, we had no idea about fentanyl, we knew nothing about it? So education is key, and I do agree with the comments that were made earlier about the need to educate families. If you're talking to your kids by the time they're in middle school, you're too late, way too late. They need to know about the dangers that are out there, especially on social media. So please, please get that campaign, get that awareness going. You know, we need billboards, we just need so much help. Families are being decimated. It's tragic. I cannot tell you. Families are forever impacted. Jody Barber and I both lost our sons in the same year, within months of each other. And we implore you to please, please do something about this. We are losing parts of an entire generation here, and families are forever changed. I can tell you that. It is devastating. I do want to say briefly before my time runs out that we do have Zoom grief support groups on Wednesday evenings at 7 p.m. You can find the information out on our website, solaceforhope.org. We also have in-person meetings in North and South Orange County. You can find that information on our website. I have brochures with me today. Please send people to our group because they need the support. Everyone is grieving and they're hurting. Please, thank you. Thank you for your time.
Thank you so much. If you get that information to our staff, we'll make sure to include that in our newsletter. Thank you. Are there any other public speakers? I can't see. It does not appear. Do we have any speakers that are on the line? Okay. And so at this time, we will close. Mr. DeMarco, you're still here. Did you want to just briefly give us an update on what our legislative priorities are and what are some of the bills that you are following and helping us to support here in Orange County?
Thank you. Good morning, Chair Chaffee, Supervisor Foley. I'm Peter DeMarco. I'm the Legislative Affairs Director for the County Executive Office. And I think the testimony that we've heard today from our delegation members and from our local elected officials, I think really sums up kind of where the county has been and where we continue to go. I will tell you that the most current version of our legislative platform, not only is there a policy statement that's added into the public safety section that specifically relates to opioids and fentanyl, that gives us direction to go and pursue support of legislation that will help the county. What I will tell you also within this document, we also include a number of different metrics to tell the story of the real Orange County. Since 2016, 2017, this document we've put together every other year includes a metric showing the number of increased fentanyl-related reports. And so it really has been one of the foundational priorities of this board, certainly since I've been here. As it relates to legislation, I think we've all heard from our delegation members the difficulty of getting meaningful legislation passed. In the past, I would say that a lot of this has started being driven by our Orange County delegation members, and the number of bills have been introduced has definitely increased, not just from our county delegation, but from elected officials throughout the state of California. And I think that that helps as we continue to increase the education and awareness, because there are definitely roadblocks as it relates to the public safety committees. In terms of specific actions that the board has taken, every bill that has addressed this issue we've brought to the board throughout historically. Unfortunately, as you've heard, they've all not really made it very far. This year, the legislature has introduced 22 bills that deal in some capacity with either opioids generally or with fentanyl specifically. What's interesting, I think, this time also is that if you take 5 of them out that are intent bills that will be amended at a later date, you're seeing an equal spread between bills that are addressing criminal penalty enhancements, as well as other legislative proposals to increase treatment, access, prevention, public education as well. We are going through those bills as we speak, and I, per the board direction, when this issue came up back in January, we are looking to determine a cycle of what bills that we will be bringing to your board for considered adoption. There are 3 that we are going to be starting off with next Tuesday, 2 of which you've already heard about in some capacity today. AB 155098 by Assemblymember Lori Davies would increase access from the retail and commercial side of paraphernalia that is currently out there that are normally used, but that would be increasing access to having the ability for testing equipment to be able to analyze were those paraphernalia sort of things, was fentanyl, could they test for that to see if there's something there? You did hear Assemblymember Petrie Norris talk about her AB 1673 with respect to establishing the California Fentanyl Abuse Task Force. And then Assemblymember James Ramos has AB 1698. Assemblymember Petrie Norris mentioned about the huge increase with respect to social platforms being used increasingly to spread these dangerous drugs. And so Assemblymember Ramos's bill would address that in terms of increasing awareness and mandatory messaging through those platforms going forward. So I think what we're seeing is a kind of a multi-pronged approach. And finally, I would leave you with this. The board has directed the county and our departments not just to pursue policy legislation and take positions, but in terms of available state and federal funding, I'm going to tell you that since 2016, the county has applied for a little over $20 million, $20.3 million to be exact. And so far, and some of those are still outstanding, but so far the total now coming in is about 17 million. So we're effective. Can we do more? I think that's certainly always, we always want to be going for as much funding as we can. And I think that we're starting to see the priorities change from the state and federal governments that are putting more dollars out there through the grant process. So we'll continue to work through our county departments, through our budget office, and certainly with your board to advocate for getting more dollars down here where we need them most.
Okay, thank you, Mr. DeMarco. And I would ask that you add to your list the AB 2446 that Assemblywoman Cotty Petrie-Norris referred to.
Yes.
That will target traffickers responsible for fentanyl-related deaths. And at the break, I had a chance to speak with all the police chiefs who were here and ask them all to collectively get to us that data that shows the costs, the burden on the taxpayers here in Orange County and each of our local agencies, and of course ask the sheriffs to do the same, so that we can start to quantify the costs of responding to the fentanyl crisis as we seek funding, and we can justify, here's why we need more funding from the state and federal partners, because it's costing us so much to respond. So that will, I think also quantifying the costs will also help us as we couple that with the data that shows the deaths, and as we start to do more investigation through the coroner's office to really hone in on whether it's a fentanyl-related death or a drug-induced related death as opposed to just a heart attack. And that will, I think, help bolster our requests for legislative reforms as well. So thank you for being here. Absolutely. Chairman Chaffee, thank you for coming back. Do you have any questions for Mr. DeMarco before we close?
Well, he's so full of answers, I should have some questions. Well, thank you for the work you're doing. And the crisis is really multidimensional. You have the law enforcement, you have the education component, and the medical side, but it's more than that. It goes into social services, the devastation it brings to families, and that kind of thing. So when we search for grants, it needs to be a broad search. Sure. And so I hope that we can find whatever it is there. I'm not sure what we need to do countywide. If there's a fentanyl czar or something, I think I will look at Dr. Chau and seek his advice on something like that, because it is a serious problem and it comes and goes from so many different directions. So thank you for being our watchdog with the legislature and Washington and other places. So thank you.
Thank you.
Thank you so much. And we will close out the hearing. Our office will compile the list of recommended actions and suggestions by all of our panelists that took the time to be here today, as well as the members of the public who joined us. And we'll make sure that we put that out so that people can see that information, and then we'll try to figure out how do we move forward from there. And I want to just highlight, we have some data related to the ages of individuals who are dying of overdose in our community. And in California, predominantly, the ages are ages 25 to 29. So just think about that. People sort of at the prime of their lives, just getting started as adults, and they're losing their lives. We have so many examples where many of us have friends or family members who struggle with addiction related to what started off as pain management due to a serious health condition. And so we just have to continue to put pressure on our hospitals, our physicians. We heard about addressing the patterns of prescriptions. We have to continue to use our law enforcement efforts to root out those who will spread poison in our communities, and we have to address treatment so that people who do get caught up in the system of addiction have a way out. And so I know I'm committed to those causes, and I know the chairman is as well. So we look forward to working with all of our partners here in the County of Orange. And thank you for joining us here today. Thank you.